5 cases of measles confirmed in Arizona, with the possibility of more on the way.
And 4 of those cases are in nearby Pinal County. They were apparently exposed to the illness during a visit to Disneyland. And so far, about 50 cases across the country have been traced to the California theme park. One reason measles making a comeback is that some parents refuse to have their children vaccinated. 9 Your Side's Craig Smith is here with more on what public health officials say on the risk of measles versus the risk of vaccination. Craig.
Stella, health officials say measles is not a trivial risk. It can be serious enough to put a child in the hospital or even kill. They thought the illness was as good as dead in this country until some parents started deciding the vaccination was more dangerous than the illness it's meant to prevent. Measles means more than a mottled complexion and a few days off from school. It can be dangerous, but also easily prevented. But for the past few years, growing numbers of parents have paid attention to reports that childhood vaccines can cause problems like autism. They trace back to a 1998 report from a British doctor, so thoroughly discredited, the medical journal that published it retracted the paper and apologized.
That study has not only been discredited, it has been refuted multiple times in the literature, i.e. not just saying that that was wrong, but actually proving how exposing children to vaccinations doesn't actually increase their risk.
But with the help of the internet, vaccine opponents persist. State health department figures comparing 2010 to last year show the number of kindergartners getting the measles, mumps, and rubella vaccine dropping. Pima County is the exception. It has the best vaccination rate in the state at 96.6%, with no drop for 2014. Vaccinations did drop in Maricopa County from 95.3% to 93.7%. The vaccination rate was lowest in Yavapai County from 90% in 2010 to 86.8% in 2014. But Dr. Garcia and other health experts say the whole community benefits when more people get vaccinations, because if fewer people get sick, they are less likely to spread the illness to people who can't be vaccinated because they are too young or have other diseases.
And therefore, it's really, really important that wherever we can, we make sure that children and adults have been vaccinated against measles.
Now, state law requires vaccinations for many childhood diseases before a child can go to school, but parents can file for formal exemptions based on a waiver signed by a doctor or based on strong personal, often religious beliefs.
Craig, thank you.